my son, my 5-month-old son, Hudson, has having a little bit of eczema. So we're doing a lot of different diet tweaks and things like that. We're on top of that. And we're starting to do a little bit of the red light on eczema for the eczema on the skin. What have you noticed with autoimmune skin issues like eczema?
Yeah, that's another kind of overall skin health is supported by a lot of peer reviewed science
Hmm.
when it comes to red light therapy. But certain skin conditions are really super interesting, especially those that are autoimmune related. And so yeah, there does appear to be a positive effect when using red light therapy for skin conditions like rosacea, eczema, psoriasis, and it kind of depends. It's like I'm sure there's like a direct physiological targeted kind of effect with when in terms of if I've got eczema on my face and I'm shining the light right at my face. Yes, there's probably a direct effect there. But I also tend to think that if it's autoimmune related and you're exposing your full body to red and near infrared light, there's probably a positive inflammatory response as well that's also
Yeah.
helping. But yeah, that's certainly an interesting category. We hear a lot of positive feedback from customers that are seeing benefits when it comes to red light therapy and conditions like that.
It's obviously modulating the immune system, probably just through inflammation reduction or just bumping up the mitochondria. Are there any other mechanisms that you could think of why it would be modulating the immune system?
Yeah, there appears to be a shift in our immune system from what's an M1 phenotype to an M2
Mm.
phenotype, where our immune
Mhm.
system becomes just. I like to use this is kind of maybe a silly example, but I kind of think of like Pac-Man. Everyone understands
Yeah.
like the
Yep.
old school Pac-Man. When our immune system begins to shift to an M2 phenotype, like our white blood cells become more Pac-Man like, so they're able to kind of eat up um, 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 cells that we don't
Yep.
want around. And so you do see a positive immune response. And I mentioned one of the other mechanisms of action that we're learning a little bit more about is this ability for red and near infrared light to stimulate TGF-1 beta, which is a pretty important cytokine in terms of within kind of the broader immune function or immune system. And that's something that Dr. Praveen Irani touched on a recent interview we did with him. He's one of the world's leading researchers in the world of photobiomodulation, but that's something his lab is learning a lot more about, is that ability for these wavelengths of light to stimulate that really important cytokine.
Very cool. Excellent. So lots of good benefits there. And then a couple questions. So why is it people have issues with fluorescent light? They're in buildings. What's that frequency? What's that doing? And why is that so noxious?
Yeah, and it could be fluorescent. It could be just any poor source, right? It could be a cheap LED device. It could be a bad incandescent source. But it's the fluorescent light is not necessarily, the negative impact is not necessarily because of the brightness of the light, like the white light it delivers. It's more the flicker effect that's happening with
It's more the flicker.
yeah. And so that's kind of sometimes that LEDs get a bad name as an example, but it comes down to like the wavelengths that are delivered from that light and whether or not the actual source is high quality. And so sometimes you'll get, inferior fluorescent bulbs that do have a tendency to flicker. And it's pretty clear that can lead to some negative, some bad health consequences, with overexposure to any sort of device or light source that's flickering. But again, the key there is overexposure, right? I mean, if you're 5 to 10 minutes a day, it's not going to hurt you. But if you're inside an office, for 8 hours a day, exposed to, fluorescent bulbs that are, have a tendency to flicker, probably not great, because that's a long period of time.
So when it comes to that, what's that frequency? Is that a blue light frequency?
That's delivering from fluorescent.
From the
It's really
fluorescent?
it's more the pulsing actually that's going on, the pulsing of that frequency of light, right? So it's most indoor lighting, as an example, is delivering white or blue light.
So on the spectrum, like we know blues at the lower end of the spectrum, meaning like 400-ish. How about white? Where's that at?
white light.
Yeah.
Yeah, it's even lower.
I was
Yeah,
even lower than that.
yeah,
Okay,
yeah,
got it. All
yeah.
right. Okay, cool. Very cool.